Hello, I'm Mark Neuman. I'm the chair of the Penn Medicine Opioid Task Force, and I'm really excited to be here with my colleagues Tanya Uritsky and Mary Caniglio to present our HCIF 2019 Safety Award for a system-wide data-driven initiative to improve opioid stewardship. Philadelphia and the US remain in the midst of an epidemic of opioid-related harm. In 2017, Penn Medicine launched the Penn Medicine Opioid Task Force as a system-wide strategy to address the opioid epidemic. We launched a Stewardship Alliance in 2019 through the Opioid Task Force, specifically to align and amplify our initiatives focused on limiting inappropriate prescribing and promoting evidence-based prescribing practices. This alliance brought together 3 existing work groups of the Opioid Task Force focused on inpatient prescribing, outpatient chronic prescribing, and outpatient acute prescribing, and retained connections to existing work groups on opioid use disorder screening, treatment, and referral, as well as to other initiatives at Penn focused on addiction medicine and supporting care for patients with opioid use disorder. Our mission as a Stewardship Alliance has been to reduce opioid-related harm for Penn Medicine's patients, employees, and surrounding communities by promoting evidence-based opioid prescribing. We engage in a variety of strategies to pursue this mission, including feedback to providers via dashboards and report cards, EMR-based nudges to promote best practices, individual outreach and education, and a centralized web repository for policies and guidance. We also engage in bidirectional learning and feedback with our providers across our 6 acute care hospitals and hundreds of outpatient locations throughout our system. I'll hand it over to Tanya Uritsky to detail some of our deliverables from this year.
Thanks, Mark. I'm Tanya Uritsky. I am the Vice Chair for the Penn Medicine Opiate Task Force. As the year has gone on, we've done a lot of work, and so this highlights some of our work for the health system. We've developed and deployed system-wide clinical decision support tools aimed at reducing excessive acute and chronic opioid prescribing, and also increasing adherence to naloxone co-prescribing recommendations from the Center for Medicaid Services. We've launched an inpatient prescribing work group that includes cross-disciplinary representation from all entities. We developed an inpatient discharge prescribing report that aims to increase quality assurance and improve practice across the entities as well. We have ongoing implementation of system-wide opioid prescribing pathways and protocols, introducing a new pathway that guides inpatient and outpatient opioid prescribing for patients who may be high risk or are diagnosed or with suspected opiate use disorder. We've developed and launched a second version of our Penn Medicine Opioid Dashboard, which you'll hear a little bit more about in a minute. And this includes new metrics looking at acute and chronic opiate prescribing across practices and across providers. We've initiated academic detailing programs that target high prescribers, and that is based on a review of the electronic medical record and claims data. We've developed new outreach and education offerings that support stewardship for entity and for service line providers. We have a new standard system-wide controlled medication agreement, which we developed new language and use standards supporting best practices and to comply with regulations. We oversaw a system-wide electronic prescribing effort that aligns with state and federal regulations. We also have ongoing engagement and coordination with the city and with state health officials in aligning stewardship efforts and optimizing activities for learning. Lastly, we have been grateful to receive recognition as top 10 in our system for our quality improvement initiative, and also receive this Healthcare Improvement Foundation Delaware Valley Patient Safety and Quality Award for 2019. With that, I'm going to turn it over to Mary Caniglio to go over some of our specific work that we've been doing.
Hi, my name is Mary Caniglio, and I'm a Master Improvement Advisor, and I provide support to the Opioid Task Force. With any process improvement project, the first thing you want to look at is data. So we were fortunate to work with our IT department and developed an opioid dashboard, which is there on the left-hand side. The opioid dashboard was used to establish baseline, identify opportunities, and to track improvements that we've made. The dashboard is in 2 sections. The left side is the chronic opioid measures, and the right side is the acute opioid measures. And as time has progressed, we've enhanced the measures a bit, most recently adding some information about the morphine MMED, which is morphine medication equivalent dosage per day. It's a way to track, a standardized way to track the amount of med that is being prescribed. As we've matured through our data collection, we have now gone and developed peer-to-peer report cards, which are on the right side. And this is a way to track an individual provider's performance. The left side tracks practices across the system. The right side says, where is an individual provider in comparison to their peers? The green arrow represents where the individual provider would be, and then there's the whole, all the bars show all the other providers. So it's a nice way for it to be individualized and the provider to know exactly where they stand. Could we go to the next slide, please? Another concrete example of an improvement that we made is we work with Epic, our electronic medical record, and we've created nudges. This example is a nudge that we created for naloxone, and this is based on best practice. So we notify a provider when they're prescribing a med that exceeds the level of 50 for MMED. And the three red circles show you the nudge that it occurs when that level of opioid is prescribed. So the provider has the opportunity to either discontinue that order that they were making, or they can then co-prescribe naloxone. We're very proud of the graph on the right side, which shows the actual improvement that we made from the time that we implemented the nudge. We had an increase of 57%. I'm going to turn it over to Tanya then. Thank you.
Thanks, Mary. So just to follow up with that, we have work planned for the upcoming fiscal year. And so here's a highlight of some of the things we're looking forward to working on. So we're developing practice and provider level opiate prescribing report cards that include comparison data, as Mary just talked about, and we would like to drive improved prescribing with these report cards and use evidence-based behavioral strategies. We're working on a system-wide opioid stewardship summit that is going to be convened with Penn Medicine Academy, which we're going to engage key stakeholders, and we're hoping to map a vision for system-wide opioid stewardship activities over the coming years. We are engaging in a citywide opioid stewardship summit focused on improving opioid prescribing, and that's in partnership with the Philadelphia Department of Public Health, fostering collaboration and learning across the city hospitals and across health systems around opioid stewardship. We are looking to revise and relaunch our Opioid Task Force intranet website, and that's in partnership with Penn Medicine Academy as well, and that will include additional resources and content and hopefully streamline provider access to these resources. We'll be expanding provider review and detailing efforts in order to identify high prescribing providers and to decrease or mitigate risk. We're continuing in-person and virtual outreach to frontline staff across inpatient and outpatient settings to raise awareness of our efforts and to promote best practices. Finally, we are continuing to work on translating new research via bench-to-bedside efforts and things like provider and patient-facing interventions focusing on improving prescribing, including text-based patient opioid use reports in order to develop prescribing recommendations to specific populations and procedures. With that, that wraps up a review of our work on the Opioid Task Force. I'd like to thank you for this recognition and for this opportunity.